A 46-year-old woman presents to your rural healthcare clinic for the first time, complaining of decreased urinary output for 5 months with a foamy appearance. She also complains of swelling in both legs. She states she was diagnosed with diabetes 10 years ago and has been taking insulin for 2 years. She does not check her blood sugars at home because she does not like to stick herself. When asked about her diet, she states that she eats the best she can for what she can afford, but often has very little appetite. The patient states she last saw her primary care physician about a year ago, and that insulin has been her only medication. It is worth noting that her husband was laid off of work a year and a half ago, and she states that she has been hit or miss in checking her blood sugar and taking her insulin as she should. On exam, the patient is obese. Her heart rate is 110 beats per minute. Her blood pressure is 198/105. Her respirations are 19 breaths per minute, and her oxygen saturation is 94% on room air. A head, eye, ear, nose, and throat exam reveal periorbital edema. Her skin is hyperpigmented on both lower extremities. The lower extremities reveal pitting pretibial edema. A urinalysis shows hyaline Cas, 3+ proteinuria and glucose, but negative for ketones. Subsequently, your current diagnosis is acute worsening of chronic kidney disease. While waiting on lab work and kidney imaging studies to come back, the patient is voicing concerns about her husband and her being out of work and them not having insurance. She's asking you and your nurse what her options will be given the state of her disease process. According to the National Kidney Foundation, 1 in 3 American adults are currently at risk for developing kidney disease. Because kidney disease often has no symptoms, it can go undetected until it is very advanced. 26 million American adults have kidney disease, and most don't even know it. High blood pressure and diabetes are the 2 leading causes of kidney disease. According to the latest U.S. Renal Data System annual report, more than 660,000 Americans are being treated for kidney failure. Of these, 468,000 are dialysis patients, and more than 193,000 have a functioning kidney transplant. As of 2013, newly reported cases of kidney failure occurred in approximately 117,000 Americans. There are approximately 6,479 dialysis facilities in the U.S. Of these facilities, approximately 617 are hospital-based. The annual Medicare spending to treat kidney failure in the U.S. is approximately $30 billion. Once our patient was diagnosed with ESRD, we explained to her that the Social Security Administration handles Medicare eligibility and enrollment, and that to enroll she would need to visit or call her local Social Security office. We also explained to her that Medicare covers certain medical services and supplies in hospitals, doctor's offices, and other healthcare settings. If she were to need dialysis, Medicare covers the cost of dialysis treatments such as in-center hemodialysis, in-center nocturnal hemodialysis, home hemodialysis, and peritoneal dialysis. Many people on dialysis are covered under Medicare Part A, hospital insurance, and Medicare Part B, medical insurance. If she were to obtain both Part A and Part B, these services and supplies would be covered as long as they are reasonable and necessary for her health. Dialysis patients need to go to a treatment facility where dialysis is covered by Medicare. When kidney patients receive Medicare, they pay 20% co-insurance, also called cost share, for dialysis treatment in a dialysis center. Co-insurance is a part in medical insurance that says the person insured pays a certain amount of money for medical treatment or fixed rate on a prescription. Outpatient doctor's visits will also cost 20% co-insurance. The same amount also relates to home dialysis training, home dialysis equipment and supplies. All of these are applicable if she has Medicare Part B. Also, if she were admitted to a hospital for a dialysis, her Medicare Part A insurance will cover those costs. For people who do not already have Medicare coverage and begin hemodialysis, Medicare does not become activated until 90 days after dialysis is initiated. A patient can be held responsible for costs during this time period if they do not qualify for Medicaid or have some other form of insurance coverage. However, if a patient were to choose peritoneal dialysis or home hemodialysis, Medicare can become activated immediately and can retroactively cover services provided even before they start dialysis if they're done in the same month in which they begin the treatment. For example, if they start peritoneal dialysis on October 22nd, Medicare coverage will begin on October 1st. If they were to start in-center hemodialysis on October 22nd, Medicare coverage would not begin until January 1st. Patients on dialysis at any age will pay a standard monthly Part B premium and likely pay for Part A. Some people will pay a higher premium based on their income. So a quick recap on our patient from clinic that was diagnosed with ERSD. So we now know that no matter the age, if kidneys are not functioning, that patients are eligible for Medicare coverage, and dependent on their history, working history, and their spouse's working history, the eligibility and extent of their coverage would be determined by the Social Security Department. So our next step would be to direct her there, either online, over the phone, or things that we could help her with in office. And then also doing our part as the primary care provider, educating her on diet, medication, controlling her blood pressure, her blood sugar, and reaching out to community resources for her so that through this process that she can have the maximum amount of support by us and by her family and the community.